Hello there, I'm Kate Miles from the Mind Body Reset, and I'm here today to talk to you about depression and what to do about it. Now, depression affects people in different ways, and anyone can be affected at any time. We all have our ups and downs, and it's very normal for our moods to fluctuate. But some people may experience more notable depressive episodes, maybe once, several times, or perhaps recurrently. Now, clinical depression, however, now often referred to as major depression, is a much longer lasting and more extreme low, which can affect your ability to enjoy even your most favoured pastimes, and despite feeling exhausted, sleep may be elusive. Depression of this type is a very common and treatable form of mental illness, but it is not something you can just snap out of. It's not a sign of weakness, and it's not something that has to last forever. Major depression can affect people of all ages, from young children and teenagers to those in their 90s and over. But there are various other forms of depression, such as atypical, situational depression, persistent depression disorder, cyclothymia, premenstrual dysphoric disorder, postnatal depression, SAD, and very serious depressive disorders such as psychotic depression and bipolar disorder. Atypical depression is a subtype of major depression characterized by oversleeping, overeating, irritability, limb heaviness, sensitivity to rejection, and relationship problems, which improve following a positive event. Situational or reactive depression, where episodes have a known trigger, such as following specific life events. Persistent depressive disorder, where depression is more ongoing and is considered to be mild or moderate. Cyclothymia, where moods are unstable. Periods of random mild elation may be experienced between episodes of feeling mildly low. PMDD, or premenstrual dysphoric disorder, where anxiety, anger and depression occur with PMS. Postnatal depression can affect 1 in 10 women within 1 year of giving birth. SAD, or seasonal affective disorder, where the seasons, especially the winter, because of the low light levels, trigger depression with increased sleep. And what are the symptoms overall? Feeling sad, irritable, angry or agitated, having less energy, especially for things you consider unimportant, losing interest in activities you used to enjoy, loss of concentration and slower than usual cognitive function, disturbed sleep, loss of appetite, lack of interest in prepping food, for instance. Some sufferers may eat more if food is put in front of them, loss of self-confidence, feeling guilty or worthless, even having thoughts of self-harm or suicide in severe cases. If you have serious or concerning symptoms, it's essential you visit your GP, and also do phone the Samaritans on 116 123. Now, the causes of depression can include genetics. So if you've a family history, you may be at higher risk. And even if you don't have a genetic link to your parents, if they've experienced depression, just being around them could affect you. Stressful life events, especially where prolonged, so relationship issues, financial concerns, housing and work issues, can make you more prone. Traumatic incidents can be a trigger. Whether it happened to you, you witnessed it, or someone you love experienced it, you may be affected. Hormones. Now, depression during the menopause is very common, and problems with your thyroid can also cause depression. Lifestyle. Avoiding exercise, eating badly or sporadically, and not drinking enough healthy fluids, plus being isolated or overweight, can increase your risk. Drugs and alcohol. Prescribed and over-the-counter medication and recreational drugs, plus alcohol use, of course, can affect mental health. So these options may seem helpful in the moment as coping strategies, but over time they increase your risk of developing anxiety and depression. Now, for treatment, seeking your GP's advice is very important as a first step to diagnosis, and also discussing your options, as antidepressants may give you breathing space to pursue talking therapy. Counselling and stress management, and where more involved, psychotherapy, are all worthy of consideration. But I do recommend Sanomentology, a hybrid of hypnotherapy, guided visualization and lucid dreaming for your consideration, as this works with the mind at a deeper level to non-traumatically diffuse the causative factors and help resolve your symptoms. but with or without medication and talking therapy, improved self-care is invaluable. Now, exercise is a positive step, preferably taken daily and out in nature. Gradual dietary change can also help, as sugar and starchy carbs can trigger an increase in inflammation levels, which may cause lethargy and mood swings. But do seek guidance on this. Breathing exercises, gratitude practices, EFT, tapping and journaling are all worthy of consideration. And joining a group can help you connect with others, understand your symptoms better and gain more information on how to turn your life around. Both in person and online groups are well worth consideration. Now, if you'd like to speak to me about how the Mind Body Reset might be able to help you, then do DM me to ask a question, set up a Health Boost audit or book a discovery call. Thank you for watching. I hope you found that useful. Goodbye.